Hey guys! The purpose of this tutorial is to help you study for and learn more about the anatomy of the heart and the blood flow through the heart. So I'm going to be asking you a couple of questions along the way, and then I'll ask you to pause the video along the way and try a couple things. So please do so that you can study and just learn it all on your own. So let's get started. The first thing I want you to do is label all of the things that are starred here. So there are a couple extra arrows that you don't have to label, but go ahead and label everything that is starred. And so pause the video and try and recall everything that's starred. Alright, so let's reveal these answers and we'll walk through it together. So hopefully you said the following things. So we'll start on the left side of the screen, which is actually the right side of the heart, because remember, this is as if this was the person whose heart this is, if it was their right side of the heart. And we're looking at the an anterior view. So this is the right side, and this is the left side. So here we have the superior vena cava and the inferior vena cava. So these both are going back toward the heart from the body, and they're going to enter into the right atrium, which hopefully you got that. So after it's in the right atrium, the blood that is, it's going to go through this tricuspid or right AV, atrioventricular valve, and it's going to go through there, and the purpose of that valve and all the valves is to keep the blood going in one direction. So once it goes to the tricuspid valve, it's going to enter the right ventricle, which is the muscular part right here. We see the thick muscular walls which act as a pump. So that's going to pump it through another valve called the pulmonary valve. And then the pulmonary valve leads into the pulmonary arteries, which we have a right and a left. And the pulmonary indicates that it's headed toward the lungs. So it's going to go to the lungs to get it oxygen. Once it has that oxygen, it's going to come back toward the heart through the pulmonary veins. Again, we have the right and the left side. And the pulmonary veins will enter, the blood will enter after that into the left atrium. So hopefully you got that. And after the atrium, the left atrium, it's going to enter through the bicuspid valve or the left atrioventricular or AV valve. After that, it enters into the left ventricle, and again it's going to get pumped through the aortic valve, and this goes out into the aorta. Now, after it leaves the aorta, it's going to go to the body. So this is the anatomy of the heart, and I sort of also walked you through the blood flow, but we're going to walk through that one more time on the next slide. But check your work, and if you got something wrong, make sure you fix it. And let's talk a little bit about the blood flow one more time. So how does blood flow through the heart? Well, as we just mentioned, it flows in one direction, and it's basically a cycle. So anywhere that we start within the heart anatomically, we can trace all those parts that we just mentioned, and we should end up where we started. So let's say that we start at the left ventricle here. And what I want you to do is I want you to pause the video in a sec, and I want you to walk through where the blood would travel if we started at the left ventricle and ended at the left ventricle. So go ahead and pause the video and walk through the blood flow through the heart. All right, let's see how you guys did. So if we're starting in the left ventricle and we are tracing the blood flow through the heart, once it's in the left ventricle, it's going to be pumped, it's going to be pumped through this valve right here, which is the aortic valve. Then it goes to the aorta, and then it leaves the aorta, the ascending and descending aortas, and it goes to the body. Because remember, this is oxygenated blood, so we have to get that oxygen to where it needs to go. So it's going to take the oxygen and nutrients to the blood, and then after it goes to the body and delivers the oxygen, it's going to come back through the inferior and superior vena cava. So from the body, right? And once it goes into the vena cavas, it's going to get emptied out into the right atrium. And then after the right atrium, it goes through the tricuspid or right AV valve, atrioventricular valve. And then it gets placed into the right ventricle here. After the right ventricle, it gets pumped through the pulmonary valve to the pulmonary arteries. Remember, arteries take blood away from the heart. It's going to go out both of these to the lungs. And we need to go to the lungs because we got to pick up more oxygen. After the lungs, it's going to return to the heart through the pulmonary veins, which take blood back toward the heart. And that's going to, the blood will be placed into the left atrium. After the left atrium, it's going to go through the bicuspid or left AV valve, atrioventricular valve, and we are back in the left ventricle. So you could start this cycle anywhere and you should end up where you started. So hopefully you were able to get that right. Go ahead and watch this as many times as you want. Pause it along the way so that you can really test yourself and make sure you have this down. Thanks for watching.